Okay, so my 5-year-old granddaughter has type 1 diabetes, and she uses the Dexcom G7 continuous glucose monitor and Omnipod 5 insulin pump. Now these are good, but they're not perfect. For example, her Dexcom G7 glucose monitor is supposed to last for 10 days, but it often stops working before 10 days have gone by. Pressure on the Dexcom G7 can cause compression lows, where the blood glucose looks very low but actually is higher than the reading on your phone. A fingerstick glucose would give the true blood glucose level. This often happens at night. Our granddaughter has to be repositioned to take the pressure off of the Dexcom G7 glucose monitor. Very annoying. So what if a glucose monitor could last for a year instead of just 10 to 15 days? Well, there is something that's called Eversense 365 continuous glucose monitoring system. So what is that? Well, it's a tiny 1-year sensor. The sensor is placed under the skin of your upper arm by a healthcare provider, and it only needs to be replaced once a year. Essentially, there are no compression lows because the device is under the skin surface. And again, it's very tiny, about the size of a Tylenol capsule. Here it looks very small, and again, it's actually 0.72 inches in length. So Eversense 365 is placed under the skin in a minor surgical procedure. They basically numb up the area, take a scalpel, make a small incision, put the device under the skin. You put steri-strips on there and a bandage. There's no stitches required. Then when it heals up, the Eversense 365 is under the skin. You can't even see it there. And so you can put a transmitter over it. Again, it's just a transmitter to pick up the glucose readings from under the skin. There's no cannula inside that transmitter. So the Eversense 365 continuous glucose monitor gives accurate blood glucose readings every 5 minutes for about a year. So if you compare the Eversense to just traditional continuous glucose monitors, again, a year for the Eversense, 10 to 15 days for the Dexcom G7, survival rate 90% for the Eversense and much lower than that for Dexcom G7. Compression lows, virtually none for the Eversense, and frequent, especially at night, for the Dexcom G7. So who qualifies for the Eversense? Well, if you're an adult 18 years old and over with diabetes, taking insulin, and again, my granddaughter's only 5, so she's going to have to wait for a while to get this. Many commercial insurances do cover this, and it's also covered by Medicare. However, some insurance plans may require prior authorization for coverage of the placement and use of the Eversense 365. So Eversense 365 is made in the United States by a company called Senseonics, and that is in Maryland. And the ticker is SENS. It's publicly traded, and there's the website. So again, when you place this thing, let's talk about how you calibrate it. First, there's a 24-hour warm-up phase. And then during that time, you can check your blood sugar and see what's going on until the sensor starts to work and you start to receive glucose values from the sensor. So when it's first placed, you have the warm-up phase, then The next day, usually day 2, you get a series of 4 finger sticks about 2 hours apart, and that would be your day 2 calibrations. Then, up till day 13, you have to check it daily, and then after that, it will be checked once every 7 days or once a week for the year. So that isn't too awfully bad as far as calibrations. You do have to do it a few times early on, but then for the majority of the year, it's just 1 finger stick per week for calibration, which I think is just fine. Now, the twiist insulin pump works with the Eversense glucose monitor. So let's talk about the twiist insulin pump. And the twiist is a tubed insulin pump. You can see the tube right there, unlike the Omnipod 5, which is a tubeless system. And twiist currently only works with the Apple iPhone and is not yet on Android phones, although they're working on that. Now you have to change the twiist pump and battery every 3 days. And of course you have to change the Omnipod every 3 days as well, so those are similar. And then here's the twiist insulin pump attached to a belt. You can see it on the right side there. And the tube would go to, say, your abdomen and into the skin. Twiist works with Apple iPhone and with the Apple Watch. Again, you can look at that picture of the Apple Watch and you can actually give yourself a bolus of insulin right from the watch. Pretty impressive. Now, for more information, you can go to eversensecgm.com and also twiist.com. There's also some very good YouTube videos out on both of these devices, so check those out. Now, this video is for educational purposes. Be sure to check with your healthcare provider for any questions you have about your diabetes. And thanks for watching. This is Stephen Vig in San Antonio, hoping for an eventual cure for type 1 diabetes.